Hi everyone, my name is Alyssa Hall. I am a Master's of Public Health student at Lenoir-Rhyne University. I'm here to talk to you today about type 2 diabetes prevention for CDL or commercial drivers. So first I wanted to speak about pre-diabetes and type 2 diabetes. So pre-diabetes is the point where it's a serious health condition where your blood sugar levels are higher than they should be. They're higher than the normal range, but are not high enough to be classified as type 2 diabetes. It is the intermediate phase before reaching type 2 diabetes. The current statistic is 1 in 3 American adults have pre-diabetes, and most of the time these can be asymptomatic, and overall about 88 million American adults suffer from prediabetes. There are several risk factors for prediabetes and the development of type 2 diabetes. These can include being 45 years of age or older, being overweight, being physically inactive. This means that you do not get exercise for 30 minutes, 3 days or less every week. If you have a family history, if you have had a parent or a sibling with diabetes especially. If you are a female who has had gestational diabetes, or if you are a female with polycystic ovarian syndrome or PCOS. So there are some long-term physical health risks that come with the development of type 2 diabetes. These can include kidney disease and kidney failure, heart attack, blindness, stroke, and the loss of toes, feet, or legs. And these are very serious, as well as the development of type 2 diabetes, and insulin use can also be a risk to your job. So I wanted to share with you, you could have gotten a printed copy, or I will give a link to the online risk assessment. This is the pre-diabetes risk test put on by the National Diabetes Prevention Program, and it was developed by the American Diabetic Association as well as the Centers for Disease Control. So we're going to go through a few questions. I'll give you a minute to get your things together. Wonderful. And we're going to go through each assessment question is worth 0 points to 3 points, and then we'll calculate your overall score at the end. So sit and think, how old are you? Are you a man or a woman? If you are a woman, do you have a history of gestational diabetes? Do you have a family history? Do you have a mother, a father, a brother, or sister who has had diabetes or is currently dealing with it? Have you ever been diagnosed with high blood pressure? Are you physically active? Do you get 30 minutes of exercise 3 times a week or more? What is your weight category? So if you look on the right-hand side of the paper, you will select your height and then find your weight, and at the bottom you will calculate how many points you get. I'll give you guys just a moment to calculate. Okay, wonderful. If you have a score of 5 or higher, it is recommended that you do contact your healthcare provider. The best way to check your blood sugar is to get your blood taken and have that assessed. So let's go over some things that you can do and you might have control over. So let's go over some lifestyle changes for prevention of prediabetes and the development of type 2 diabetes. Keep healthy snacks in your truck as you're driving throughout the day. These things could include dried vegetables, fresh fruit, and make sure you're drinking plenty of water throughout the day instead of sodas and things like that. Try to get exercise for 30 minutes per day. And these don't have to be completely consecutive minutes. Maybe you've stopped at the truck stop for a little bit and you are getting out to stretch your legs, maybe go grab a snack, maybe take a lap around the parking lot. Or if you're on a long run where you stay overnight and your company pays for your lodging at a hotel perhaps, maybe take advantage of that fitness room that they have. Get on a treadmill, walk for 30 minutes, or get some light aerobic exercise. Healthy meal prep. If you have the time during the week or on your off day, prep your lunches, prep your meals and snacks. Put it in your electric cooler with you. If you have that option to heat it up, great. But if not, if you're out and you need to stop at the truck stop or a fast food restaurant, make smart eating choices. Maybe opt for the lean grilled protein and a vegetable side instead of French fries or another fried item. If you currently use tobacco products or smoke cigarettes, it is advised to stop smoking. Do your regular health screening, stop at Walgreens, Sam's Club, do some of that, and then maintain your annual preventative appointments. And then utilize your support systems as you're trying to make these lifestyle changes. Make sure you reach out to those in your circle or line of work with similar goals. Create a group text thread with people that you know and encourage your goals. Reach out to your human resources. See who you can contact if they have programs already in place. Healthy Truckers Association of America has a pre-diabetic prevention program, as well as the CDC Lifestyle Diabetes Prevention course. Here are resource links, and I hope you have a great day. Thank you.